There's an opportunity for brain tumor patients of all ages, their family members and friends, to have some of their questions answered. UW Health is hosting that event. Their providers serve more than 1,200 brain tumor patients each year.
And joining us tonight to talk more about the event and some groundbreaking new research that is increasing the life expectancy for brain cancer patients are Dr. Ian Robbins and nurse specialist Lori Hayes from UW Health. Thank you both for being here.
And a special friend.
Yes.
Thanks for being with us.
Dr. Robbins, tell us about this groundbreaking new technology.
So
what is this?
It was discovered that if you can set up an alternating electrical field, and the signal strength is between ultrasound and microwave, that you can disrupt cancer cells as they begin to divide. And this technology is now FDA approved in both newly diagnosed and recurrent glioblastoma. The same technology now is being developed and tested for a variety of other cancers, including lung cancer. There's a clinical trial that's just opened up at the university. Another trial will open up very shortly for pancreatic cancer and potentially brain metastases. There's a clinical trial nationally for ovarian cancer.
Is this a potential cure or just extend life?
There are a minority of patients whose possibility of getting out beyond 5 years is doubled or tripled with this device, but that's a small number. But the majority of patients in different subsets will have a marked increase in survival, measuring more than a year.
Lori, this is something that patients are going to want to hear about.
Yes, well, we're fortunate that we can offer this to our patients.
So tell us a little bit about the conference and the topics you're going to be talking about.
Well, we started in 2008 with our first conference, and this is our first year of hosting a pediatric and adult conference together. And so we have someone who's going to be talking about CBD oil, and is it a magical medicine or a mythical or misguided myth? And we have someone who'll be talking about to patients who have vestibular dysfunction, so they have facial nerve paralysis, and treatments that can be offered for that. The pediatric journey is a little bit different. They're talking a little bit about diagnosis through survival, because that's such a different trajectory than adult patients may have.
It takes such fear out of it, I would think, to know that you're not alone on this journey, just to meet other families that are going through the same experience.
That's one of the things they love the most, is that opportunity to network.
1,200 patients a year at UW? Is that what we said?
Yes. Yes, between benign or non-cancerous and cancer patients.
Dr. Robbins, are we seeing an increase in
There has been an increase over the years. We actually don't know why. I think the incidence in the United States in adults is about 16,000 patients a year. I think when I started out in neuro-oncology, it was closer to 10 or 11,000.
And how do you diagnose? How does someone get to you?
So typically there are neurological symptoms followed up with an MRI, and the MRI is usually diagnostic. And typically we start out with surgery followed by chemotherapy and radiation, and now this is a very valuable adjunct to what was standard therapy in the past.
What does this involve for a patient?
It is a commitment. There are no side effects except for skin irritation. And in fact, Lori has kind of pioneered techniques for eliminating that. But basically, these arrays are placed in a strategic place based upon the patient's MRI. It's mapped. And the patient has to maintain these arrays and an electrical current, either wall current or a battery pack, pretty consistently. And with slight interruptions for showers or periodic MRIs. And the longer the current is going, the more efficacious the therapy is.
And this is covered by insurance?
It is.
So you keep that on, you keep the electrodes on all the time?
Yes.
Correct.
Once the arrays are replaced, they're on 24/7, and they're changed every 3 days.
It's fascinating, isn't it?
It's a huge commitment for the family as well, because the patient's not able to apply the arrays themselves.
But if it buys you more time, and a significant amount of time in some cases, then it might be a sacrifice worth making.
Yes. In our experience, every patient who started this followed through. We've never actually had a patient quit once they've made the commitment to do it.
When you started out practicing, would you ever imagine there'd be something like this?
No, and in fact, when I first heard about this, I considered it to be witchcraft. It wasn't until some data started pouring in that I became convinced that this was a useful therapy for the treatment of brain tumors.
Wow, it's pretty amazing. And advancements continue all the time.
Absolutely, and there are great advancements being made in other forms of cancer therapy.
Well, keep up the incredible work that you both do, and thank you for coming
Thank you.
today.
Thank you for having me.
Let's tell folks about the seminar specifics. Here we go. It is this Saturday. Registration 8 a.m. Program is at 8:30 to 12:45 at the University Hospital Health Learning Center. That's at Highland Avenue, in the main hospital, UW Hospital.
Lori, is there any cost involved?
No, there is not.
And can you just show up, or do you need to pre-register?
At this point, you can just show up.
Wow, that's great.
Yeah,
That
we
couldn't
have
be
room.
easier.
Should be a great afternoon, a great morning. Thanks for being with
Thanks
us.
to you
Thank
both.
for
Great to see you.
sharing this information.